we believe that when people are in those types of settings, that it's easy to have transmission, and that is why we reduced it so that we can get people to be home earlier. And we are hopeful that by doing that, these measures would help to reduce transmission, especially from these crowded places. So we are hopeful that we'll see a reduction in transmission, and perhaps we'll start seeing that in the numbers maybe about a week or so from now.
Okay, and are there any other measures that have been implemented?
So there are national measures that cut across the whole country, and then there are specific regional measures. So, for example, because we've had spikes of cases in Region 9, we have put in special measures in Region 9, restrictions of movement and so forth. Region 7, we have specific regional measures as well. And again, that's because we have a spike in cases in Region 7. So what we have done, based on the epidemiological situation across the country, we are able to disaggregate that by region. We know how many cases we have in a given region, how many are active, what's the rate of transmission in these regions. And based on this set of information, then we make decisions of how to tackle the epidemic in the particular region. So we try to tailor-made or customize the measures to suit specific regions, and that is what was done in this particular order.
Okay, great, Minister. And the healthcare workers are obviously at the front line of the COVID-19 pandemic. Do you care to elaborate on the preferential treatment of the healthcare workers?
Well, one of the things that we want to do is to show appreciation for the people who are in the front lines of this pandemic. And one good way of doing that is if when our healthcare workers go to, say, the banks or other institutions where they have to transact business, as a form of appreciation, if we can pay that courtesy, give them some preferences, I think that goes a long way, because they have been at the front line, they have been putting themselves at risk in treating patients and so forth, and the least we can do is show appreciation. And so this has been in the orders before. I don't think it was probably highlighted, and so we want to highlight this part of the orders so that more people would become acquainted with it, and perhaps when they see a health worker, they'll be able to help out and show their appreciation for the work that our health workers have been doing.
Okay, great, Minister. And what are your thoughts on the public servants and other agencies working through a rotational system?
Well, the reason why there's a rotation system is to reduce density in our indoor spaces. Every ministry, every organization would have their own set of norms, and once they're able to work that out and comply so that you don't have too much of crowding within an office, then that would be fine. What we are looking at is to ensure that wherever you're working, you have adequate social distancing measures. Every workplace should actually come up with their own set of plans, utilizing the broad principles that we have established. Those principles are, one, that you're able to sanitize your hands regularly. Two, to have social distancing, so at least that's 6 feet apart. And so you don't want people to be, very close to each other and so forth. So even when, there are common spaces within a work environment where people tend to congregate, so for example, maybe at the water cooler, going into the kitchen, so you have a chit chat and then you make some coffee or something like that. We don't want that to happen, because as people get closer to each other, then the chances of transmission, becomes higher. There have been some studies that have shown that in indoor environments, especially if it's not properly ventilated, that you can have viral particles that circulate if somebody who was positive was there. And therefore, you need to take these precautions and make sure that the indoor environment is also safe. So reducing the people's density, so to speak, within offices is one strategy of ensuring that we reduce transmission. The other thing is that I think when some people come to work, they feel that because they're in a known space, that it is a safe space. But if it's a public office where there's daily interaction and different people coming and going, that known space, or what you consider as a safe space, if you had an infectious person who visited, they can easily contaminate that space. And that is why it's absolutely necessary that once you're doing those public kinds of interactions, that people in the office also wear masks. I think many of the office environments, people feel, well, there's no need. We know everybody here or whatever. But when you let your guard down like that, that's one way that transmission can occur. So again, we need to put all these measures together, and each workplace, whether it's government or non-governmental, must have a plan for safety in the workplace. If they need guidance, the secretariat, the COVID secretariat can provide that guidance to them. But generally, these principles are well known.
Minister, we know that daily we have a gradual increase of cases, and that's due to more testing. But with the both airports being closed, how do you see that helping to limit the spread of the virus?
Airports generally, like our first case that came to Guyana was an imported case. So one of the things, there are countries around us, other countries in the world where the incidence of COVID-19 are much higher. And the chances that persons traveling from those countries coming into Guyana, they can actually come with the disease. So one way of limiting spread, or one way of limiting the importation of the disease, is to restrict movements through our airport. And so we have had these measures in place for a while now, and we are now trying to put specific measures in place so that even when people travel, that the travel is safe. So let's say because while we say the airport is closed, it's closed to commercial traffic, but we still do allow repatriation flights. So it's not like nothing happens at the airport. There are still flights that come and go, and we have been having them almost weekly, flights that come in and go. We also do have cargo flights that bring things to Guyana and take things out, right? So this thing about closure is closure to the regular commercial flights. Now, having said that, if somebody is traveling, coming to Guyana, we have put certain requirements in place. So one is that the person must apply to come back home, and they must show that they have a negative PCR test that was done within the last 5 days. Once they meet that eligibility criteria, they will be listed, and they'll be able to buy their tickets and come back home. We have also started working on a plan so that when we fully open the airport to commercial traffic, that we'll have some things in place. Those things would entail when somebody come from abroad, although they might have had a PCR test done at their place of origin, when they get into Guyana, we want to have the capacity to be able to test them back right at the airport and get back their results perhaps within 2 hours, 3 hours or so. And then we release them out into the general public. And even at that stage, because of the way that the disease operates, that somebody can test negative now and then a couple days after develop the disease. because it really depends. The test is sensitive to the amount of virus in your body. So if you just got exposed and just got infected, you might not have enough virus in your body for the test to detect. So at the point of exposure to the time of detection, generally the experts advise that at least we look at maybe about 5 days, and around the fourth, fifth day after exposure, that is perhaps the best time when you have adequate viral loads for the test to work properly. So even if we test you at the airport, right, we would still want you to be in self-quarantine for the next 7 days. So those measures are the types of measures that we are putting in place. And even those flights where people are coming back on those repatriation flights, it is a requirement for them to be in self-isolation for the next 7 days, right? And our staff here at the ministry would normally follow up with those passengers to ensure that they're in self-quarantine. And so these are measures that we take to ensure the general safety of the Guyanese public. And so far, they have been working relatively well.
Okay, great. Minister, I know a few days back you were working with Honorable Minister Indar and GPL and GWI to get the Liliendale COVID-19 hospital up and running. And as of yesterday, there were some patients that were transferred. Can you tell us how many patients were transferred yesterday?
Well, we had some teething problems in getting the place up and running. Among those was the electricity. We did not have electricity from GPL powering the building. We were able to solve that with Minister Indar's help. We also had issues with water and sewage. I spoke to Minister Colin Crowell, who has been very instrumental in getting GWI to help us on the water side, and to make sure that we have proper sewage systems and so in place. Now, the measures that we have there for water is temporary because we have a number of black tanks that are acting as a water bank, and GWI is supplying us with water from one of their tankers, so every day they bring water there. The sewage is a little bit more complicated because what was built did not meet the standards that was required by the authorities, and so they have asked us to build a different sewage system. So that is currently under construction. In the meantime, we have been able to put in temporary facilities there to allow sewage. So that was one of the hurdles why we weren't able to get people in there before, but we have fixed that as of yesterday with the temporary solution that we have put in place. Yesterday, we were able to move 6 patients from the maternity section of the Georgetown Hospital into the facility. Today, some more patients would be going across there, and hopefully, gradually, we will start occupying the sections that we have identified. While we are doing so with those particular sections, we are also going to be working on other aspects of the facility so as to get it ready, just in case if we need to put additional patients there.
So it's maternity and COVID-19 patients, or just?
We do have maternity patients that are COVID-19, so that's the category of patients that we have put there so far. But our intentions are to add persons who are in the transition ward of the GPHC for them to go to another part of the hospital. And these would be positive patients that would have maybe mild forms of COVID-19. And they would be able to be properly isolated in the sections that we have identified.
Okay, Minister, final question. Would you like to comment on the APNU and AFC's statement that said you released Christopher Jones' COVID-19 test results?
Well, this is a matter of, it's a public health concern. And that is, first of all, we have to understand that we have an order in place, and we also have a public health law. that law clearly states that if anybody knowingly spread an infectious disease, then they're committing an offense. Uh, the Parliament and the clerk of the Parliament 2 days ago put out a letter to all members of Parliament to clearly state that if you have COVID-19, that you shouldn't attend the Parliament in person, but you can do so virtually. So I guess the Parliament recognized that there might have been members of Parliament who have been affected by the disease, and they offered a different methodology for them to participate in the proceedings of the Parliament. Now, what we had yesterday was two members of Parliament who have tested positive, and instead of staying in self-isolation as is required by the order and is required by the law, decided that they are going to breach those orders and law that we have and attend Parliament in person. One of those persons is Mr. Jones, and the other is Mr. Sherrod Duncan. Now, from the information that I have now received, having saw that this went public, from the information that I have now received, they were tested, they were advised that they should stay home for at least 13 days, the first 10, and then the second 3, once they were asymptomatic, that they would then finish their home isolation. Both of them are still supposed to be in home isolation. And at the time when they got the positive test, to when Mr. Jones was in Parliament and Mr. Duncan was in Parliament, it's within that time frame. So both of them have breached the rules that we have for self-quarantine. This is actually very highly irresponsible of them to come to the Parliament and endanger their colleagues, endanger all of us who was in the Dome, all the workers, the parliamentary staff, and everybody. So this is unacceptable behavior. It's really highly irresponsible for them to know that they have a positive test and yet show up in the Parliament. And as the Minister of Health, I think when I see that the public is put in danger in such a way, then I have a right to inform the relevant authority, and in this case, the persons who are managing the Parliament. So that is why the clerk was informed yesterday, and I'm following up with an official letter to the clerk to point out, because now the persons who were exposed to these two gentlemen would now have to take precautions. They might, if people were in very close proximity to the two, they might now have to take measures for self-quarantine, and eventually after 5 to 7 days, probably they will require to have a PCR test. And this is because of the reckless behavior of two members of Parliament who really should have known better and should have stayed away from the sitting and do so virtually. So these are the facts. And I think now that the APNU and AFC has made that public yesterday, that the public ought to know that these two persons have really behaved irresponsibly and recklessly, because now they have exposed other people who unknowingly and unwittingly was associated with them yesterday and even before, because I understand that they have breached these rules and have been in the public domain when they should have been at home. So I hope that they would curb such behavior, stay at home, self-quarantine, and stop endangering the lives of other Guyanese.